limited access to service to stigma and intense social pressure. So today's the discussion will focus on these three societal dimensions of mental health in Malaysia. So first, we will examine the sufficiency and effectiveness of mental health policy and their implementation. So second, we will explore on the social stigma as the major barrier to accessing mental health care, including how societal perception and cultural expectation discourage help-seeking behavior. Third and lastly, we will discuss on the key that causes contributing to mental health problem among young people, particularly in relation to academic pressure, family expectation, social media influence, and also economic uncertainties. So to explore these important issues, I'm joined by these three distinguished panelists, which is our first panelist, Chok Jaji, that will address whether Malaysia's current mental health policy are sufficient and effectively implemented in meeting the needs of the populations. So our second panelist, will discuss on social stigma as a major barrier to mental health care access, which is and how societal attitudes continue to shape perception of mental illness. So this topic will so without delay, we'll move on to the first panelist, which is Chok Jaji. So Chok, from your perspective, are you thinking that Malaysia's current mental health policy sufficient and effectively implemented?
All right. Thank you, moderator. Today, I will share about our Malaysia mental health policy are sufficient and effectively implemented under the SDG 3 good health and well-being in today's discussions. Okay. As we all know, in September 2015, the topic of mental health was included in the United Nations Sustainable Development Goal SDG. In this historic step, the United Nations acknowledged the burden of disease of mental illness and defined the mental health as a priority for the next development of 15 years. So mental health is a current issue that becomes a problem among developing countries, especially in Malaysia. So, Malaysia National Mental Health Policy as one of the measures to address the growing of the mental health problems. Today, I will focus three principles of the national mental health policies and by including the accessibility and equity, comprehensiveness and continuity and integrations to have an inclusive look about implementation of mental health policies aims to improve the mental health and well-being of all Malaysian citizens. So let's see for the first principle of mental health policy, which is accessibility and equity. The supply and distribution of the mental health workers in government healthcare, especially psychiatric and clinical psychologists, is problematic because the distribution is uneven and heavily skewed towards urban centers. The shortage of clinical psychologists is critical and affects the accessibility to mental health service in public healthcare in certain states and rural areas. The shortage of clinical psychologists also result in a compromised service standard with the issue of ranging from waiting periods to make an appointment to limited consultation hours with the mental health specialist. Secondly, the mental health service in Malaysia are still incomplete and less comprehensive, as the number of psychiatric beds to the population is the ratio of 2.7 units per 10,000 population, which is low compared to the other countries. So meanwhile, some smaller district hospitals were less comprehensive, especially in the terms of the psychiatric manpowers and facilities. In the WHO World Health Organization Mental Health Atlas 2017 found that median government expenditure on the mental health care in high-income high income country was USD 80.24 per capita, while the upper middle country like Malaysia was only USD 2.62 per capita, would result in an negative impact to the comprehensiveness level of mental health services in Malaysia. Thirdly, nowadays we can see the mental health has been included with the public primary healthcare. And recent public primary healthcare clinics have expanded their services included with the mental health promotions. So this integration could be an issue. Why? As the primary healthcare sector has been operating beyond its limits. This is because the average ratio of physicians to populations in the Malaysia public healthcare sector is zero point 0.9 per 10,000 populations. This situation affects the community continuity and integration principle, which emphasized in the mental health policy to achieve the objective of the mental health policy of improving the mental health and well-being of all citizens, all matters that are deemed to be important should not be overlooked. By the recommendation to the mental health policy, is the government need to solve the shortage of the workforce in the mental health field because this problem affects the accessibility and comprehensiveness or in the principle that were emphasized in this policy. Next, the relative low numbers of psychiatric may be linked to a negative stigma towards the mental illness among the medical professions. So the government should give the medical student exposure to clinical settings to give them exposure to a certain extent in terms of the experiences of working as a psychiatric and dispel all the negative stigma about the professions. So to conclude, after a long discussion, I think Ministry of Health should improve and amend to mental health policy to create a more accessibility, comprehensive, and continuity mental health policy to all Malaysian citizens. So thank you.
Okay, I would like to thank our first panelist for the insightful and valuable share. So, from your discussion, it is clear that while Malaysia has a mental health policy in place, its effectiveness is limited by challenges in implementation, particularly the shortage and uneven distribution of mental health professionals, limited funding, and also the strain on primary healthcare service. So this issue affect accessibility, comprehensiveness, and also continuity of care, highlighting the need for stronger workforce planning and also policy improvements to ensure better mental well-being for all nations. So based on what you have shared, I want to ask a question, which is, do you think that Malaysia's mental health policy is strong in theory, but weak in implementation, or and especially due to maybe shortage of mental health professional and funding? What do you think,
Okay.
panelist one?
Okay. Thank you, moderator. I think Malaysia mental policy should have improvement not only by the implementation, but what we need to focus also, which is the government should should allocate more allocations to the mental health police in the areas of the mental health. By if the this area of the mental health don't have enough of the allocation and funding, so that is very hard and difficult to improve the comprehensive and continuity of the mental health policy. So I think the government in the budget should improve and allocate more funding to the mental health field. So that's we can to improve the effective and the sufficient of the mental health policy, right?
Yeah, I agree with you, panelist one. Maybe we should allocate more on the field, which is mental health field. So let's move on to our panelist two, EYE. Maybe you can share with us what is the social stigma that become a major barrier to this mental health care access. So I would like to welcome Liu Yin.
Okay, I will be discussing about social stigma as a major barrier to mental health care access in Malaysia. So basically, stigma is one of the main reasons why individuals with mental health condition do not seek or effective mental health treatment are available. Many people avoid getting help because they are fear of being judged, labeled, or discriminated against. According to the Association for Psychological Science 2014, stigma exists at three different levels, such as public stigma, self-stigma, and also structural stigma. Public stigma involves negative social society stereotypes such as viewing people with mental illness as weak or dangerous. This attitude leads to social and discrimination. The second one is self-stigma. Self-stigma occurs when individuals internalize these negative beliefs, causing shame and low self-confidence. As a result, they may choose not to seek professional help and even when they are suffering. The third one is structural stigma. This stigma refers to systemic barriers such as inadequate funding for mental health services, limited insurance coverage, and unequal treatment of mental health compared to physical health. This factor further reduce access to care. A Malaysian case study by Pictures 2023 highlight this issue. This study described a young woman with recurrent suicidal ideation whose condition worsened due to stigma and delayed intervention. This case shows how stigma can directly affect the treatment outcomes. In conclusion, stigma, whether social, personal, or structural, remains a major barrier to mental health care access. Thus, reducing stigma is essential to encourage help-seeking behavior, improve access to services, and promote better mental health outcomes in Malaysia. Thank you, moderator.
All right. And also systemic and can discourage individuals from seeking help, delay the treatment, and also worsen the mental health outcomes. So addressing stigma through this public education, supportive policy, and equal treatment of mental and physical health is essential that so that we can improve the mental health care in Malaysia. So based on your explanation, I want to ask you, uh, can you describe about the public, self, and also structural? So which type of stigma do you think is the biggest barrier to Malaysians from seeking mental health treatment? And why do you think so?
Okay, thank you, moderator, for asking. Based on your question, just now you asked me, right? What is the biggest barrier in Malaysia according to the situation? I think, for my opinion, I think the biggest stigma is self-stigma because stigmas occur when individual internalize these negative beliefs, causing shame and low confidence. To solve this issue, right? To solve the issue, our school and leader plays a key role in outcoming social stigma, especially regarding mental health. Schools can educate students, normalize conversations, train teachers, and establish peer support programs to reduce fear and shame. Leaders, on the other hand, can lead by example, run public awareness campaign, provide adequate funding, and collaborate with professionals to make mental health services accessible. Together, their effort can challenge stereotypes, encourage help seeking, and create a more supportive and inclusive society.
Okay, thank you, panelists too. That was a very clear explanation on the questions. So moving on to our third panelist, which he will discuss with us or tell us the key factor that contribute to the mental health challenges among our young people itself. So I would welcome our third panelist, our last panelist, which is Sharul, to explain or discuss further on this issue.
Thank you for moderators. So good afternoon, everyone. As a panelist, I would like to focus on the key social factors that contribute on mental health problem among the young people in Malaysia. So today, young people experience stress from multiple directions at the same time. So academic pressure is one of the biggest challenges. Exam, high expectations, and fear of failure can cause constant anxiety. At the same time, some young people face family instability, such as financial struggles, conflict at home, or lacks of emotional support. So when this pressure comes together, it becomes difficult to young people to maintain their mental well-being. So this shows that stress is not caused by one issue alone, but by a combination of everyday challenges in a young people's life. Another major factors affecting young mental health is the social media. While social media help us to stay connected, it also creates an unhealthy comparison. Many young people feel pressure to look perfect, live exciting life, or meet unrealistic standard they see online. Cyberbullying, negative comments, or fear of missing out, as we all know as FOMO, um, also can increased feeling of anxiety, low self-esteem, and loneliness. So this reminds us that digital space are not neutral, but they strongly influence how young people feel about themselves. And finally, socio-economic factor such as poverty and limited access to mental health service cannot be ignored. So young people from disadvantaged background often face a higher stress levels and a fewer support options. So this makes them more vulnerable to mental health problems. Strong support system and fair access to service are essential to ensure no young people left behind. In conclusion, youth mental health reflects in the society we live in. So if we want to achieve SDG 3, which is good health and well-being, we must address not only individual behavior, but also the social, digital, and structural environment shaping our society life. Thank you.
Okay, I would like to thank our third panelist. Thank you, Cheryl, for the sharing. Okay, so to conclude, your sharing is about the youth perspective is so clear. So your discussion highlights that mental health challenges among young people are shaped by multiple societal factors, including academic pressure, family circumstances, social media influence, and also socio-economic inequality. This reminds us that improving youth mental health requires not only individual resilience, but also supportive environments, fair access to service, and also the responsible digital spaces in line with the our SDG 3, which is good health and well-being. Okay, for your question, I think maybe we should look forward on you did mention about academic pressure as a major source of stress among young people. So, what do you think, or how can the schools, universities, and also the parent themselves reduce the academic stress while still maintaining high educational standards?
So thank you for the question. So basically, I would like to enhance here that actually academic pressure is created to young people to actually to gain them academic achievement, a better result for their academic achievement. So for example, like most of the young people are eager to get the flying colors in their exam and throughout their semester. And these things actually are really a crucial factor because this academic achievement can also be a crucial factor to find a job and to create a first impressions to an employer. So instead of focusing on academic pressure or academic achievement, we need also to focus on soft skills, buildings and development of the characters and personality instead of focusing only on the academic parts. So for me that we actually needs to be um, balanced in parts of academics and personality because that actually can bring us to a better options and better opportunity in the future.
All right, so thank you. I would like to thank our third panelist for that sharing. So we come to our end of the session. As we can conclude today's discussion, several key messages stand out clearly from our panelists. First, while Malaysia has a mental health policy framework in place, its still impact is limited to by challenges in implementation, particularly in terms of workforce shortage, funding, and also the service accessibility. Second, we have stigma, which is whether public, self, or structural, remain a significant barrier that prevents many individuals from seeking or continuing mental health care. So finally, from a youth perspective, mental health challenges are shaped by broader societal pressure, including academic stress, family circumstances, social media influence, and also the socio-economic inequality itself. So together, this insight remind us that mental health is not just a medical issue, but also a societal responsibility. So achieving the SDG 3, good health and well-being, requires this coordinated effort from policymakers, healthcare provider, educational institutions, families, and also communities to create this a supportive, inclusive, and also accessible mental health system for all Malaysians. So I think that's all for today. Thank you to our panelists and to everyone who has joined us in this important conversation. Thank you, everyone. Dah boleh berhenti kot? Dah boleh berhenti dekat. Ya.